Hello everyone, I'm Richard Conway from Dublin, Ireland, reporting for Room Now from ACR 2022. And I'm here to talk to you today about an oral presentation on Monday. This was by Matthew Baker and colleagues. And this was on the reduction in RA interstitial lung disease risk with Tofacitinib. So this was a retrospective study using the Optum database. And they had 28,500 patients with rheumatoid arthritis who did not have pre-existing interstitial lung disease. Around 1,500 of those were treated with Tofacitinib, and the others were treated with other biologic agents. So they did a number of different analyses here. First of all, they calculated crude incident rates for the development of interstitial lung disease in the patients on these biologic agents. And for those, they found that adalimumab had an incident rate of 3.43 per 1,000 patient years, rituximab of 6.15 per 1,000 patient years, tocilizumab of 5.05 per 1,000 patient years, abatacept of 4.46 per 1,000 patient years, and tofacitinib of 1.47 per 1,000 patient years. And they adjusted this for multiple other variables, and they found that tofacitinib versus adalimumab had an adjusted hazard ratio of 0.31 for the development of interstitial lung disease in patients with rheumatoid arthritis who are treated with biologic agents or tofacitinib. They then went on and did a second analysis of this. They did a prevalent new user cohort design with propensity score matching. And again, comparing tofacitinib and adalimumab as the main analyses. And they found that the incident rate per 1,000 patient years of new RA-ILD was 1.48 for tofacitinib and 4.30 for adalimumab, giving an adjusted hazard ratio of 0.33. So this is interesting data. It's still very preliminary. It's a retrospective database-based study with all the inherent limitations of that. But it is encouraging to see some potential evidence for a drug which could prevent the development of interstitial lung disease in rheumatoid arthritis. We know that 8 to 10% of patients with rheumatoid arthritis develop this complication, and when they do develop it, the prognosis is not good at all. The median survival is 3 years after diagnosis of RA-ILD. So any agent that could potentially prevent this would be very welcome. We'll wait and see what further studies of JAK inhibitors in this area show. So remember to check out Room Now for all the updates from ACR 2022, and you can follow me on Twitter at Richard P.A. Conway.